In the coming years, the number of people living with Alzheimer's disease is expected to swell exponentially in Pennsylvania, one of the oldest states in the nation. The increase in dementia and the need for care will affect nearly all of us, and the cost and the emotional toll will be immense. Yet experts and advocates give the state a near failing grade in its efforts to prepare for the coming crisis in dementia care, according to a recent investigation by Spotlight PA and our partner Newsroom Public Source. An official state action plan has sputtered for years. High costs could push families and care facilities to the brink, and those serving on an unfunded state task force concede time is running out and fast. And that's why today's event is so important. Good afternoon and welcome to another Capitol Live event brought to you by Spotlight PA. I'm Christopher Baxter, Executive Director and Editor-in-Chief of Spotlight PA. For those of you who are new to our work or our programming, Spotlight PA is an independent, nonpartisan newsroom producing investigative and accountability journalism about the state capitol and urgent statewide issues. We share all of our journalism at no cost with now 77 community newsroom partners all across the state, all part of our mission to better inform and empower Pennsylvanians everywhere. Our work is driven by a deep sense of public service, and it's powered by you, our readers and our members. Simply put, without your support, Spotlight PA and this programming and all of our journalism would cease to exist. Consider any number of Spotlight PA stories or investigations you've read in the past 2 years, and then consider the fact that none of them would have ever happened without readers like you saying, yes, I value this work, I will support it. So today I'm asking everyone who is able to please take a moment right now and pay what you can for this event by visiting spotlightpa.org/donate. Again, the address is spotlightpa.org/donate. We provide these vital public service events on the honor system. We're able to keep attendance free for all by asking those who are able to make a contribution of any amount and become a member of Spotlight PA. This is entirely an honor system, but we do rely on your support. Again, the address is spotlightpa.org/donate. If you're already a member, thank you. You're already doing your part in helping make this work possible. And we want to thank you again. A few last housekeeping items you've probably already seen, but just in case, we are recording today's event to share with those who couldn't make it. Thank you to all who have sent questions in advance. We will get to as many of those as possible. If you have not yet asked a question, you can use the Q&A feature right here in Zoom. To do that, just click on the Q&A icon in the bottom toolbar and type in your question. And now I'm excited to introduce one of Spotlight PA's reporters, Colin Deppen, who will be moderating this afternoon and who will introduce you to our awesome panel of experts. I'm so excited to hear this event and learn more. So Colin, over to you.
Thanks, Chris. And hello, everyone, and welcome. As you all know, we are here to talk about Alzheimer's disease and dementia rates in Pennsylvania. It's an incredibly important topic, especially in this state, one of the fastest aging in the country. We're going to try today to provide some perspective on this issue, but also some guidance. And helping us do that is our esteemed panel here, who I'd like to take a moment to introduce. First is Juliet Ryle. Juliet is a freelance reporter with publicsource.org. They're a Pittsburgh-based nonprofit media outlet. And Juliet has written extensively about issues around healthcare and access, and worked with us on this project as well. Next is Kathy Cubitt. Kathy is an advocacy manager with the Center for Advocacy for the Rights and Interests of the Elderly, frequently known as CARI. They're a nonprofit that aims to improve the well-being, rights, and autonomy of older persons through advocacy, education, and action. Clay Jacobs is executive director with the Pennsylvania chapter of the Alzheimer's Association, the largest nonprofit funder of Alzheimer's research in the world. And Jen Holcomb is chair of Pennsylvania's Alzheimer's State Plan Task Force and a director of memory support at a nonprofit retirement community in central Pennsylvania. So I'd like to jump right in. First question, I'd like to start with Clay. First question is about detection, and essentially, what signs, symptoms should loved ones be looking for? Is within that, is there a genetic component to Alzheimer's disease or dementia rates? And are there any steps people can take to prevent the symptoms, the onset of Alzheimer's disease or similar dementias? Clay.
Thank you, Colin, and for Spotlight, not only for your coverage, but bringing us together today. And I think what you highlight is an important question because it's one that so many individuals and families deal with. identifying what is normal aging, what is not, what is dementia versus Alzheimer's disease versus frontotemporal, all of these things. And so you highlight warning signs. Ultimately, by its very nature, dementia is an insidious disease that's progressive, that gets worse, that interferes with daily living. So a lot of times the warning signs are things like that, right? You see people in severity and frequency see symptoms increase. And it could be a whole slew of things, right? We look at changes in personality or word finding difficulty, in memory and recall, in doing familiar tasks. And ultimately, while we see the person we care about changing, this is a neurodegenerative disease when we talk about Alzheimer's disease and other dementias. And so it's their brain changing. And so the ability to recall and connect and do some of those things increases. And it's this cumulative change that sees the severity of symptoms increase to it. I think when we look at that, when we see those warning signs, those are the triggers to talk to family of choice, to reach out to our physician, to find out what's going on. Whether it's Alzheimer's disease or not, what we're seeing is things getting more severe that are keeping you from do the things you want to do day to day. We know, and often folks think of what that means 5 years, 6 years down the road. When we think of Alzheimer's disease, we think often of those in the middle and late stages. But this is a disease that starts 10 to 20 years before we see symptoms. And so keeping an eye to some of those things is particularly important. And I think it goes to those two other pieces of your question. You asked about that genetic component. Genetics certainly play a factor, and there's certainly genetic markers we know that put people at higher risk. But like many diseases, it's about risk. What increases your risk? How do you mitigate that risk? It is the smaller percentage where we know it's directly linked to genetics, where we know someone will get it, often in younger onset Alzheimer's disease. And so it's how do we balance those risks for ourselves, and knowing that age is the single biggest risk factor for Alzheimer's disease. With all of that, and when we start talking about risk, we really look at it from a public health lens like we do for heart disease and other things. And so you asked about prevention. I would say that right now, the strongest evidence base is around protection. What do we do to protect our brain, to build our cognitive capacity and neuroplasticity? We know that the disease starts so long before we see symptoms. And so that lifelong focus on health. And there are certainly significant trials going on right now, including the largest ever lifestyle trial happening in the US right now, called US Pointer, which is trying to determine what is that prescription on risk reduction with social activity, healthy diet, mental activity, exercise. What are the things we can do for all of us? Because if we can delay risk or delay symptoms, the impact for families and individuals is just so significant. And it becomes a health issue rather than solely an issue about caregiving or aging.
We'll talk a little more about this shortly, but on the issue of care homes, personal care homes and the long-term care facilities, one of the things, as Juliet and I were reporting on this issue, we heard from folks who said how difficult it was sort of vetting, finding a place they felt comfortable trusting with a loved one with an Alzheimer's disease or dementia diagnosis. And I wanted to ask you, Jen, if there's anything you can recommend people do when it comes to vetting a facility, should their case or their loved one's case sort of, arise to that level that it would require that more full-time long-term care. I wondered, what tips can you offer to people who are trying to be sure as possible that they're comfortable, that this is the kind of place they'd be comfortable placing a loved one in?
Sure. So it's a very good question because there are a lot of facilities that can offer this type of support, but it does boil down to a person's level of comfort. And I always instruct people to start the process early. Even if you think that you may not need a care home, it is always the best step to start to explore what options may be available, as well as how the option will be covered by payment source. So there are some resources available. The Pennsylvania Department of Health has a wonderful website that actually you can select a county and then look at all the facilities within that county. You can look for personal care homes, and then you can drill down a little bit further and actually look at inspection reports. And you can read through those inspection reports to get a sense sense of what's happening in that facility. Additionally, you can also go to medicare.gov and do nursing home compare, which again allows you to look at 3 different factors. You're looking at health inspections, you're looking at staffing, and then just the overall quality of care that the facility provides. So it really allows you to compare and contrast to get a good understanding of the types of facilities that are close to you, or the types of facilities that you may want to consider. Lastly, on the medicare.gov, they have a resource book. It's a link there that goes through things to consider as you are exploring a personal care or a nursing facility, and questions that you should ask. I'm a big proponent of going in off hours, so not scheduling a tour. Now, right now with COVID, that can be a little tricky, but really trying to explore the facility during off hours when a lot of people aren't necessarily there, from an admin perspective, and to see what the life is like, and talking to other residents who live there, get their perspective, asking them those questions. But I have found that tool guide that CMS offers on their site. It's a PDF that you can print out with lots of different questions that you can inquire, helps you to prepare for that formal tour, and to get the information that's really necessary to make the best decision for your loved one.
I have a quick follow-up for Clay. It says a reader submitted question from Kathleen and Jackson E. Are the rising rates in the care crisis only happening for Alzheimer's? We hear a lot about the exponential growth projected in Alzheimer's disease cases, but are they also, is that, a similar rise being seen with overall dementia diagnoses as well?
So overall dementia, yes, right? As we look at, and we're even understanding it more, right? Our understanding of the disease as we get to differential diagnosis, we are diagnosing more accurately, more consistently, and that's paired with the aging of our population, right? Not only in Pennsylvania, but across the country. And so when you add all of those factors together, yes, we see rates of dementia increasing. And I would say often in a case where they're undercounted, right? So for example, in Pennsylvania, we look at 280,000 people diagnosed. We expect that to increase to 320,000 in just the coming few years. That's not counting the families and workplaces and communities, all those around those diagnosed. But even how we track and measure this, we know that diagnosis, less than 50% of the time are people diagnosed and is it notated in their medical record and disclosed to them. We know things like behavioral risk factor surveillance system, which is what tracks other public health issues. Pennsylvania is one of 5 states that hasn't yet included cognitive or caregiver modules for the upcoming surveying. And so it's also really hard to get a handle on exactly what we're looking with when you start talking scope and scale. We could just take some of our best modeling to get there, and we know that it is already at, but becoming even more insurmountable in the coming years.
Thank you, Clay. My next question is for Juliet. If anyone watching isn't familiar, Juliet wrote a piece as part of our larger coverage package around this issue on unpaid family caregivers. There are an estimated 500,000 of them in Pennsylvania alone. And I wanted to ask you, Juliet, based on your reporting, this can be all-consuming, taxing work, clearly. And I wanted to know, through your reporting, what you learned about the needs that the average, unpaid family caregiver is facing or expressed to you, and sort of where do they feel that help is lacking and that more help is needed?
Yeah, absolutely. It certainly is all consuming. That's a great way to put it. As we know from statistics from the Alzheimer's Association, almost a quarter of unpaid caregivers in Pennsylvania are reporting feeling depressed, and throughout the nation, over half of these unpaid caregivers rate their emotional stress as high or very high. So this is taxing for many people. And it was already a problem before the pandemic, but like with so many other things, the pandemic has certainly exacerbated that. And one of the issues is that many of these folks are caring for their loved ones by themselves. They have the sole caregiving responsibilities, and they don't always feel like they can go to family or friends for help. And what that leads to is these caregivers essentially being on 24/7, having no time to relax, take a breather, and recharge. And it can be very draining. So the mental health piece is a huge one. And then the other piece is the financial side of things, which we'll get into a bit later as well. But this can be a huge financial burden, even if you're keeping your loved one at home. Caregivers typically spend thousands of their own dollars over time providing care. So both mentally and financially, they're facing huge challenges.
My next question is for Kathy, and I think Kathy will have some interesting perspective on this. And the COVID-19 pandemic revealed a lot about our long-term care facilities, our elder care facilities in Pennsylvania. With the number of Alzheimer's cases and dementia cases expected to grow so exponentially in coming years, potentially exceeding the capacity that we currently have here, especially in state-run and operated facilities. Kathy, I wondered if you could sort of forecast a bit for us whether or not you expect the elder care market to meet demand, and also, what happens if it doesn't?
Well, I would actually respond to that question to say that because of COVID in particular, we are at a point where we are not even currently meeting demand. This is both for people that are getting help at home, as well as people in facilities. The majority of people with Alzheimer's are cared for at home, as Juliet outlined. And about half of the residents in nursing facilities have some form of either Alzheimer's or dementia. So the staffing shortage, which is all over the news, and this is something that's been coming and reported on, and recommendations that have not been responded to for years. The bandwidth has snapped. And so it will only get worse unless something is done. To answer your second question, what does that mean for caregivers and people with dementia? Needs get unmet, and it's important to support caregivers, as Juliet explained, because the outcomes will not be as good for both the caregiver or the person with Alzheimer's. And that's true as well as the caregivers in nursing facilities, which the shortage impacts, the aides and caregivers there as well. And this is why proper staffing is critical in terms of number and training.
Kathy, quick follow-up. When you say undersupervised case, what does that look like typically? Does that mean a patient who isn't accessing the healthcare they need? Just for those watching who may be unfamiliar with the term.
Well, I think in terms of what you're referring to is that particularly as the disease progresses, as Clay had laid out, people do require 24-hour supervision. Certain behaviors, they may wander, they may do other unsafe things. And so it's important that, a plan be in place or someone be present that can respond. And if that is not available, whether it's at home or in a facility, again, negative consequences can occur. And quite frankly, what happened during COVID really illuminated, particularly in facilities, when family caregivers and loved ones were locked out. They are always critical to the care of residents. And we saw dehydration, malnutrition, we saw excess deaths. So people that with Alzheimer's that never got COVID, in a sense, died because of COVID. And I think this relates to what you're speaking to.
Thank you, Kathy. This next question is for Clay, and Jennifer, feel free to weigh in as well. In terms of the kind of care that someone requires, how do you know when it's, it's acceptable to keep a loved one at home versus putting them into a nursing home facility versus memory care, which is an even more expensive option inside of many of those facilities? I hoped, Clay, you could sort of, hint at what the parameters are, sort of generally speaking.
Yeah, certainly I can provide some context. And I think the underlying as we look at this is one of the things, and particularly when we touch on care planning in a second, often these decisions are made because of a need or reaction rather than the ability to plan out. But we think of this really as a continuum of care, right? That starts on early symptoms and support at home for folks to remain at the most appropriate level for them. It is how we access and receive services through home and community-based services, as Kathy mentioned. And then whether it's assisted living, personal care, skilled nursing, or even a continuing care community where individuals can advance to different levels. And the nuance of, does that mean with a partner or a spouse, and how do we balance all of those things? The unfortunate reality, I think the context of what you lifted up is what's the appropriate level of care. But I think often with families, part of what we see is not only that, but also the ability to navigate the financial landscape to do so, right? So for example, someone runs out of funds to be able to support their time in a personal care home, a transition may be needed, but it's likely not prior to their prior home because they were in that level of care for a reason, but they may end up in skilled nursing. And it's a great example where quality of care is available, but maybe at a higher level or higher cost than they need at the time. And how we coordinate these things from regulatory and transition and others, we often are disparate. And so it's even more challenging for families to navigate because it's about person-centered care and care planning. Conversations with your doctor and family and social workers or care managers. For people like that connect with folks like Jen and her colleagues, right, are able to navigate these things because they have someone who can guide them through that process and help them make decisions who know the field. I think even as we think of that idea of care planning, often we're talking, and I think even the context of the question was in the mid and late stages, but something as simple as what does it mean to have that conversation with the person with dementia early on in the diagnosis, to be able to plan finances and then be able to say, okay, at this level of acuity, this is what level of support we need and how do we get there together? Ultimately, we know there will be an increased need, right? The definition of dementia has this connection to activities of daily living, but it's about that team working together, knowing what to expect, having that conversation, and being able to do that care planning side of it. And even to that end, we know there are things like right now, federal legislation, the Comprehensive Care for Alzheimer's Act, which talk about that is actually the single most important thing to be able to help families navigate the appropriate level of care and the impact that would make on quality and costs. Those are the types of things we can connect in. So I think that's maybe the important context or level set. I know you'd mentioned Jen, but I think that's an important context because it is about the person, it's about their level of care. And also in Pennsylvania, sometimes it's about what level of care you can access in a way that's in your community, right? With some of our more rural communities, the difference between having to move an hour away and being that much further from family, and how do we balance all of those types of things? And so I wish there was a straightforward, complete answer, but it is that how do we support families through that network to help them make the right decisions for them and their loved one? Those are some of the opportunities I think we have.
That geographic disparity is a great point, and I'm really glad you brought that up. Jen, given your role with memory care, I hoped you could quickly tell people watching what that is and essentially who needs it typically.
So when we talk about the memory care support programs and pieces, I think Clay highlighted it very well that it really boils down to a reaction. So there's a situation that occurred which prompts people to pursue placement into facilities. So one of the things that I feel is really important that we also address is that caregiver component of that grief, that guilt, that emotion that goes along with placing their spouse of 70 years. This is not an easy decision. So having someone to be able to kind of hold their hand and support them through the emotions of that grief, it becomes really important. And that's the type of programs that have worked really well in our area, is just being able to have someone to walk alongside that caregiver and that person who's living with the disease process to support them with each step that they take. So that way they feel comfortable as they're making these really, really, really tough decisions.
for those that do the caregiving themselves, Juliet, again, wrote about this and reported, spoke to a lot of people doing that, a lot of the loved ones performing that work at home. What are some of the reasons, Juliet, that the people you spoke with and met with decide to take on that work, caring for a loved one with Alzheimer's or dementia disease, doing it at home as opposed to putting them in a facility that could do it 24/7, essentially? What were some of their reasons?
Yeah, for a lot of folks, it's as simple as wanting their loved one to be more comfortable, wanting them to be in their normal surroundings, near friends and family, and also wanting to not be separated from them. The caregiver also wanting to still be with them and spend time with them every day. I spoke to a woman named Lee, who is a caregiver for her wife. And I asked her this exact question because her wife did need a high level of care. Why keep her at home? And Lee just said simply that she loved her wife and wanted to be with her and thought that that was the best thing for her. So for a lot of folks, it is not wanting to be separated and wanting their loved one to be as comfortable as possible. And then another huge factor that we can't ignore is the cost of some of these facilities. These places are so expensive. Colin, I think you and I were both pretty floored when we were doing this reporting and seeing how care facilities, depending on the level of care, can be thousands of dollars per month. And that's really prohibitive for a lot of families. Another caregiver I spoke to named Kathy, her husband is in the early stages of dementia, but she is very worried that if she has to move him into a full-time facility at some point, that she herself won't be financially sound anymore if something were to happen to her down the line. So that's a huge piece of it. And I also just want to mention that I actually connected with Kathy and a few other caregivers who we spoke to for this series on a Facebook group for caregivers support group. And this one had I think 40 or 50 40 or 50,000 people in it. But a lot of caregivers are finding emotional support through these online groups. And there are, of course, excellent groups in person throughout Pennsylvania as well. But for folks who, due to the pandemic or other reasons, can't make it to an in-person group, there are dozens and dozens of groups online. Some are neighborhood-based and some are throughout the country that people are really finding that community and emotional support.
It feels like a natural segue point to talk about just how expensive long-term care can be. And I want to open this question up to everyone, but if Kathy's okay with it, I'd like to let Kathy sort of lead this one off. But essentially what I want to ask and what I want to know is, what's available in terms of coverage? Is that kind of service, is that kind of care covered by insurance, private insurance? Is it covered by Medicaid, Medicare, long-term care insurance? How viable is that? I want to give everyone a chance to weigh in, but Kathy, if you wouldn't mind, what can you tell us about sort of coverage options and the financial resources available to help access this kind of care?
So it's, again, as the conversation already alluded to, it's very complex. One major myth that many folks believe is that Medicare covers long-term care. In short, it does not. It will cover short stays after, acute episodes in a hospital, things of that nature. But the long-term care that people with Alzheimer's typically may need is not covered by Medicare, in short. There are programs through certain programs through the Veterans Administration that can help. They're the major payer, besides people paying, out of pocket, and the caregiving, the unpaid caregiving we already mentioned, is through Medicaid, which is a federal and state program. But I think, as Juliet alluded to, people have to spend down to be financially eligible as well as clinically eligible. In the case of spouses, I do want to mention there are protections for spouses to maintain the home, to maintain a base amount of income, to maintain certain savings, so that individual does not need to become impoverished if the other spouse needs paid care in a skilled nursing facility. But this does not cover assisted living. But the Medicaid program called Community Health Choices can cover care in a skilled nursing facility or care at home. We have a carry line, a free toll-free number I can put in the chat. We can walk people through, what the options are, how to apply to different programs. There are some free programs through the Department of Aging that may be eligible. Again, sometimes there's waiting lists, but we can explore a variety of options for people that may need help, and we provide that assistance for free.
Just a quick follow-up. In our reporting, spoke to, or subsequent to the publication of our reporting, rather, spoke to a woman who said that her mother exhausted all of her savings through elder care, and that was the best day of her life, because once she did that, she was then finally able to qualify for financial support. Just to illustrate how stark this issue really is. Jennifer, anything you want to add in terms of financial resources available to families? Is there anywhere people can go if they aren't in spend down territory, for example, and they're looking for help?
Yeah, so the options are pretty limited, and that's what's really very frustrating about this for individuals. As Kathy summarized, the insurance component can be a little bit challenging, and a lot of misunderstandings surrounding how Medicare and Medicare Advantage plans work. I do think, I have seen a rise with long-term care insurance policies where individuals are purchasing those policies, but the flip side is they don't always understand what they're purchasing, and there might be some components of that policy that they have to meet before they can actually qualify. I just spoke to a lady the other day. Her mom has a long-term care insurance policy. She's in a personal care home. She needs assistance, and she doesn't qualify to use her policy. So I think you really have to do your homework, so to speak, and really investigate what are the parameters of these policies, what type of resources are you able to fund into caring for your loved one, reaching out to your local area agency on aging for direction, support, and guidance, and then making sure you understand the options you have available to you and what that means for you and your loved one.
I'm gonna pivot here. In the interest of time, we have a lot to get to, obviously, and I thought this question was especially important, as Chris alluded to, or rather mentioned at the top of the hour. The staffing crisis inside Pennsylvania nursing homes is particularly pronounced, and especially so, during and coming through the COVID-19 pandemic. Kathy, I wanted to ask you, in terms of recruiting and retaining the workers needed to do this really, really vital work. The pay is said to be insufficient. There are ongoing efforts at the state level to increase the amount of investment in staff, inside long-term care facilities in Pennsylvania. But I wondered, from your perspective, what can or should be done to sustain this workforce, especially as this need continues to get greater and greater here.
Well, that's a very important question, obviously, and not only, again, for long-term care facilities, but also for the home care sector that we just described, because most people are being cared for at home. And we're already experiencing problems, not only in nursing facilities not being able to find staff, but also home care or personal assistance services agencies being able to find staff to fill shifts and cover care that's approved, and people are eligible for at home, but they can't find the workers. So we are in a clear crisis. There's a combination of things, as you've mentioned, Colin. One, it's clear this work demands more pay. for retention. These workers often now are eligible for public assistance like food stamps and Medicaid for their health coverage. They should really be getting health care benefits, as well as training is such a critical component as well, particularly when you're talking about caring for people with Alzheimer's or dementia. The Pennsylvania Department of Aging sponsors something called the Long-Term Care Council. I believe it was in 2019, they issued a report. And again, there's been reports now decades old that repeat common themes, and they do relate to better pay, better working conditions, benefits, training, things like this are outlined in that report. We have some hope on the horizon in the influx of some federal dollars that are coming through. The Office of Long-Term Living is going to be boosting pay for home care workers starting in January. More details will be released soon. And we're hoping some of the federal dollars as well are going to be put towards better staffing in nursing facilities. But we still have to follow through on the strategies that have been outlined, for years now.
And Jen, just a quick follow-up on that. In terms, given your role, in terms of training, do you think we are doing enough to make sure that this workforce is prepared for, especially the complexities of something like, a dementia crisis here in Pennsylvania?
The short answer is no. I do not feel that we are doing enough. It is working with individuals that have these neurocognitive disorders is very specialized, and it takes a special person as well, those soft skills to be able to support individuals living with this disease, because each person is their own person. It's not like if you're supporting a person, on day shift, that doesn't mean evening shift is going to be exactly the same. You're going to face different situations and complications. And I think that organizations as a whole need to really look at how are they supporting the staff as they're one-on-one with these individuals within care facilities. And organizations need to recognize that having someone there to triage some of these concerns to avoid rehospitalization of individuals living with neurocognitive disorders or inpatient psych stays, having some extra support and good training helps to prevent those things from happening. So the long and short is no, we are not prepared with the education piece.
And Jen, correct me if I'm wrong, but sort of best practices and our approach to treating these cases has changed a lot, in the last 50 years. It used to be very sort of medication focused. And
Yes.
We are now evolving in how we conceptualize care for people with dementia cases. Can you tell me a little bit about that in terms of where the emphasis is now?
Yeah, so we have been seeing a shift in how we care for people. If you talk to nurses who've been in the industry for 30, 40 years, they'll tell you, oh, reality orientation, that's what we've always done. That's what we do. And, really that has shifted. We're focusing on that validation component and really supporting the person where they're at in their journey, treating them as a person. I have interacted with so many people one-on-one, supporting families through this journey. And it is a truly wonderful experience when you teach that family how to interact with their loved one in a way that promotes safety and security and trust and relationship, and really be intentional about that, the joy that you can have in this journey. And I think those are the pieces that are shifting. It's really about focusing on that person as an individual person and looking at their history, their life story, who they are as an individual, and how can we pull the best parts out of them. The other piece for me is looking at the individual, looking at what they're still capable of doing, not what they're incapable of doing, and how can we promote the skills that are remaining and continue to encourage use of those skills. So there are a lot of things that can be done, a lot more than what we can talk about today, but primarily focusing on that person as an individual.
The next question is for Clay, with a follow-up from a reader. As I said earlier on, the Alzheimer's Association a huge funder of research. And I wanted to ask Clay specifically, why is it that we know so little about this disease roughly 100 years after its discoveries? What are some of the factors? What are some of the reasons that we haven't learned more and more quickly?
Yeah, so thank you for that. And the one piece I'd reframe is that we know significantly more now than we did even 10 years ago. So your context of the first case, certainly, right, for almost a century was viewed as a regular part of aging, hardening the arteries, senility, all of those types of things. And the work around research didn't really move. Even in the US, and the US is the largest funder of Alzheimer's disease and dementia research in the world. From 1983 to 2011, funding stayed flat and essentially penny on the dollar to what we spent on all other disease research. It isn't until 2012 that we started seeing increases moving towards what the NIH was saying was needed to just start beginning research, right? And so we're talking within the last 10 years, we've seen that investment in research starting to scale up, which means long-term research is still guiding to some of those things. That's coupled with things like challenges in getting people to enroll in clinical trials. Even something as simple as medication, if we think of it, we know the disease starts potentially 2 decades before we see symptoms. And even in the 80s and 90s, we're testing interventions on folks who had severe symptoms. So the disease has insidiously been working for 20 to 30 years, and we're trying to pull back time then. What I would say in terms of what we know now is we've seen those increases, but we've also seen advancements. To Jen's comment around training and other, we know evidence-based pieces on care and support and how do we intervene there. We know that our diagnostic criteria and diagnostic tools in research settings right now have changed drastically. In fact, CMS is right now looking at approving PET imaging and how the increase, because we know we can do it with accuracy, lumbar punctures, things like blood biomarkers are being actively used in research settings now. What does that look like in a couple of years? Well, we could get a blood test that would show or help confirm a diagnosis. So our understanding of the disease continues to grow, even on things like risk reduction. While they've typically been small studies, we've all probably seen on the news, hey, drink an extra glass of red wine or have some chocolate. The largest ever lifestyle trial is going on in the US right now. The US Pointer study, which hopefully will have a prescription essentially for risk reduction. I think the other piece to that, and so there's a lot to unbundle there. We know things like lowering systolic blood pressure, reduce your risk, all of these other pieces. But even with all that, one of the stark things that I think anyone in Pennsylvania should be acutely aware of is when we interview communities of color, their perception on whether they'd have access to a treatment or risk reduction or others, the majority believe that they wouldn't. And in fact, most research is not inclusive. Right now in Philadelphia, there's something called the New Idea Study, because there was a large scale imaging trial that went on a few years ago, and the representation from communities of color was less than 2%. And so even as we're learning more, can we make sure that it's true for all Pennsylvanians, all Americans? We don't know. And so I think we're learning more. I think there's significant work going on. Even the Department of Health in Pennsylvania recently funded over $11 million in research. We're funding north of $7 million. We're finally seeing the investment needed. And the positive side of that is for every chronic disease in this country, when we've invested in it, we've made movement. And we're starting to see some of those things around detection, diagnosis, treatment now, that hopefully within the next 5 to 10 years, how we view all of this changes significantly. And so even when we talk about care and other components, we're trying to catch up to the current reality, not even looking for what could be the potential change in how we diagnose and coordinate this in the next 5 years. And so how do we catch up and be prepared for the future? I think that's a really important question as well.
Quick follow-up, Clay, from audience member Faith D. How close are we nationally, internationally to developing a truly preventative vaccine?
So I would say on a vaccine, there are certainly trials on that. What you do see are, you have the first FDA-approved treatment, which has certainly been controversial, but for those who it appears to be effective in attacking a hallmark of the disease. What I would say from a very practical standpoint is you have more medications in phase 3 trials, which is the phase before commercial availability now, than we have in the past quarter century. And so what I don't necessarily see, and I don't think we hear from researchers, is this eureka moment, but this idea of could we, with lifestyle, reduce risk for 25% of the people who get it? With management of blood pressure and diet and exercise? Could we have something, if we catch it early, that would delay the onset of symptoms, right? Because what we talk about is if we have the disease, but we don't have symptoms, if we can keep people from getting mild cognitive impairment, which we know is a stage to be able to get to dementia, can we delay? And those types of things, just like biomarkers for heart disease, right? We test for cholesterol, we then have some lifestyle, we have some medication pieces that hopefully avoid the most serious. That's some of the most exciting work in this space. It's not curing the disease, but if we could keep millions of people from ever getting it or getting the most severe symptoms, I think any one of us would take that right now as we continue to find a world with a cure. And I think for the first time when we talk to researchers, there's real hope that that is a reasonable thing, not just within our lifetime, but within the coming years.
Thank you, Clay. I want to get to some reader questions to make sure we have some time to address these. This one is from Anthony T. What can a 95-year-old U.S. military veteran with mild dementia who was recently denied home care services by the U.S. Veterans Administration due to receive home care services? Jen, Kathy, either of you comfortable weighing in on that?
Sure. I think, again, unfortunately, sometimes people apply and do all the right things and yet get denied for programs and services they are in fact eligible for. We at CARI help advocate for people all the time. Sometimes one piece of information isn't submitted. For example, applying for community health choices, which I mentioned, can be it sometimes take people months to get through that process. So I would recommend that he contact our toll-free line at 1-800-356-3606 and speak with one of our advocates. Again, there's a range of programs. Some are free, some have waiting lists, some have complicated application processes, but we can talk to him about his personal situation and anyone else that may need that kind of help.
Thank you, Kathy. And just a quick note for the audience, if we aren't able to get to your question, please email that question to events@spotlightpa.org, and I will personally respond next week. But we'll make sure to get you an answer. So I don't want anyone to feel left out. So if we don't get to yours, please email that at events, EVENTS@spotlightpa.org, and we'll make sure to get you an answer. One more question from a reader here. This one I think Jen can speak to pretty well. Is what are the services provided for the $5,000 a month charge? You know, essentially, what's covered under memory care? What are the services that memory care constitutes? And there's so this person says they have a $5,000 a month charge, and there's an additional $1,500 a month charge that covers the memory care. What's covered by that? What are the services included, Jen?
So typically, and this is going to be a broad perspective, but typically what you'll see is the custodial care. So the care and services, the physical care, the emotional care, the meal service, the laundry service. So you'll see that as a package deal. Typically what you'll see as an additional charge is related to the secured environment. So there's higher staffing levels because it's a secured environment. So the risk of people attempting to leave the environment does cause us to have to increase the staffing ratios. You should also see an increase in staffing in regards to engagement. So activity programming for your loved one. Memory care is designed to be a social program. So you should see more activities being offered from the beginning of the day to the end of the day, 7 days a week. It shouldn't just be Monday through Friday from 10 to 2. A good memory care program is going to have programming running from about 9:30 in the morning to about 8 o'clock in the evening, and a variety of different things that are offered. So typically that higher rate is because you are paying for a higher staffing ratio, you're paying for the secured environment, you're paying for the expertise of that staff, and you're paying for the engagement, the higher level of engagement that comes along with the program, including all the other base services that you get.
Terrific. And that question was from Lydia K. And Lydia, I know you asked a couple questions in here about our reporting process for this project. Again, please feel free to email those to us at events@spotlightpa.org. I would be happy to answer those in the coming days. In our last few minutes here, I want to talk about resources. Juliet did terrific work on this and compiled a number sort of tailor-made for the at-home unpaid caregiver. But I want to open it up more broadly to let each of you share resources you think anyone watching this should be aware of. But Juliet, if you wouldn't mind, can you tell us a little bit about the resources available to people, with Alzheimer's disease, or rather their loved ones who are caring for them? What's out there? What should they be looking into?
Yeah, I just dropped a link in the chat to our story about caregiver mental health, which if folks scroll almost to the end of that, not quite to the end, but you'll see where that list is, so you can take a look yourselves. That list mostly includes free resources, so it has great things like the Alzheimer's Association 24/7 helpline that caregivers can call if they need help with something. Also, the Alzheimer's Association has great online resources. Folks can also look to the Pennsylvania Caregiver Support Program, which was actually recently expanded to provide financial support for caregivers. And there's eligibility requirements, but it's worth looking into. The area agencies on aging, I believe every county should have one. But those are a great resource, and most of those have lines that folks can call as well, or emails, or even stop in person. And then what was interesting too, while we were doing this reporting, I didn't realize that so much. Sorry, this is my cat. I promised he would make an appearance at some point. But there's actually also a market for private consultants. So if families are wondering how to keep their loved one at home and can afford to hire a private consultant, we mentioned a couple of those in our main story in this package. So those are folks who you can hire to answer your questions about your loved one and how best to support them while at home. And there's also, for folks in the Western Pennsylvania region, there's even a nonprofit called Hope Grows, which is a nonprofit that supports caregivers, actually not just for people with Alzheimer's and dementia, but any type of caregivers. That can be parents, that can be people caring for their aging parents, anything like that. And they help to provide what's called respite time. So they enable those folks to get some time off from their caregiving duties. And that is, again, I believe just for people in the Western Pennsylvania region, but you can read about that in the link I dropped as well. So there's a number of things out there, and I'm sure that other panelists have some great ideas too. Colin, I think you're still muted.
Thank you. If anyone else has anything to add before we hit our outro here, please let us know. Jen, are there any resources that haven't been mentioned that you think are worth mentioning here?
I do. I really am a huge proponent of adult day programs. That is something that is underutilized because I don't think people truly understand the value of those programs. So utilizing adult day program allows for that respite. So if someone wants to utilize the program for one day a week versus every day, you certainly can customize it to meet your needs. So it does give that caregiver an outlet, a little bit of a break. So I would highly encourage you, Juliet, you mentioned the area agencies on aging, connecting with those individuals. They can give you guidance on where those adult day programs are, because that stimulation will help to keep your loved one at home longer because they're engaged in meaningful programming and that's challenging the brain, physical exercise, all these things that Clay was talking about with some of the studies going on. So I would highly encourage people to check those programs out.
I would just like to jump in a couple quick points. One is, if people are feeling their rights are being violated in any setting, in the long-term care facilities, they can contact an ombudsman who can help. And again, Carrie can help with other issues as well, or get you connected to those ombudsmen. And another key point that's important for really anyone as we age is to get your financial affairs in order. And I know someone put in the chat, Senior Law Center, they can help people get connected to, get wills, advance directives, all kinds of important documents that should be in place while the person still has some decision-making capacity to pick who they want in these important roles. And I also put in the consumerfinance.gov. They have great resources for people that are managing other people's money, as well as for consumers about a lot of these different financial important topics.
And Colin, if I could, I think, and I appreciate that, all of the resources, I think it's incredibly important. I think what strikes me, rather than additional resources, as Juliet lifted up some, is that we've talked about from diagnosis to late stage care. And this is the only disease I can think of where, from the questions we're getting, where folks have to find their own way to find out how to navigate it to this extent. And so when we started talking about things like the state plan and coordination across state departments, partnership between private and public business and care settings, that is why it's so important, because for folks to have to be able to find a link or a phone number or others in a disease that is fatal and impacts communities at such a large scale, that's actually the thing that, as we look at advocacy and other, we need to move so that too many families don't continue to fall through the cracks. So I'm just thankful for this type of conversation, because that is ultimately what our goal is.
I have just two more audience questions I think are really important, and I want to squeeze in if at all possible. This one is from Marlene H. Marlene says, when my husband was still living at home, I used an adult daycare to take some of the stress off of me and add more stimulation to his day. I got financial assistance from the VA and the Office of Aging, but once he entered full-time care, they no longer offered me any assistance. I was now paying more for his care, but getting no assistance. Why is this?
So I'll take a stab at it. I don't know that we could truly answer why that is without knowing the specifics surrounding that situation. Every situation is looked at differently, but depending on if you went into a skilled nursing facility, there may have been a spend down piece that you may have had to meet before he could qualify for medical assistance. Hopefully that spousal resource assessment was completed, so we know exactly how many resources were protected for that individual. I'm sorry, what was their name? Marlene? Was it Marlene? For Marlene. So there are a lot of variables that without knowing the specific situation, it's hard to really pin down and say, this is exactly why. I mean, if you would like to talk about it, I'm happy to talk with you privately. My information's available. I'd be happy to do that.
And this question is from Zachary Z. What changes in regulations, not recommendations, but actual policy changes around dementia and Alzheimer's training would the panelists recommend for both home care and nursing home settings?
So I'd like to pop in, because I do think there are pieces now. Skilled nursing regulations are coming out on staffing and others. I think acuity training requirements, there are dementia care best practice. I mean, there is significant evidence base from NIA, from private industry and others. And so we can get into specific, but I think it is that person-centered care training documentation, but I also don't think it's related to a specific setting, right? This is across the spectrum of care. It then gets into staffing and reimbursement and training and all of those other things. What I would say is one of the biggest opportunities in Pennsylvania specifically, many of these settings are regulated and overseen by different departments. And so the opportunity to coordinate with an eye towards dementia is pretty significant, so that people are getting consistent quality care with the level they're at. I know Jen will likely have input as well, but there are certain criteria and other things we can go through from an evidence base we know provide better outcomes. That's probably more than we have time for today, so we could share after. But Jen, if there was anything from your perspective.
Yeah, I do think from a regulatory perspective, not just recommendations, there does need to be some built-in requirements, because typically that is the Bible for nursing facilities and personal care homes. So in personal care homes, they do have a requirement for memory care areas to have specific training every single year. So it just needs to be more standardized across the continuum, because if it's not regulatory driven, there's a dollar amount that goes to that. So if it's not regulatory driven, you're not going to see people investing in the money in the funds to make that happen. So definitely a bigger conversation than what we have time for here today.
I think we've packed a lot in. Cannot thank you all enough. I want to turn it over to Spotlight PA's Executive Director, Founding Editor-in-Chief, Chris Baxter.
Great. Thank you very much, everyone. Such a great discussion. We're at the end of our time. We've actually gone a little bit over, and that's wonderful. I want to thank everyone for their time, particularly our panelists, and also for a great and lively discussion. The dementia care crisis is critical and, in our opinion, not receiving enough attention in the media, and yet it affects so many of us, whether among our immediate family, our extended family, or friends. So forums such as this one to discuss how to get help and resources are really vitally important. Today's event was a free public service provided by Spotlight PA, and so this is the time I'd like to remind anyone who did find this event helpful and who have not yet made a contribution and are able to do so, please go now to spotlightpa.org/donate. Again, that's spotlightpa.org/donate. Only takes a second, and contributions of any amount are tax deductible and help us keep this programming free for those who need it most. And of course, as always, your support goes directly back into Spotlight PA's journalism. I want to once again thank our panelists. I want to thank all of our members who made this programming possible. And most importantly, as we like to say at the end of these discussions, that these events are very important, but actually the important work continues now when it ends. And that is continuing to talk about this, continuing to provide resources to those who need it, and continuing to raise awareness about these really important issues. Thanks again to everyone, and I hope you all have a great weekend.